Welcome to The Explainer. Today, we're going to take a deep breath, literally, and look at the science behind asthma, one of the most common respiratory conditions on the planet. We're going to explore what exactly is happening inside your body during an asthma attack and how modern medicine steps in to help. So, here's our game plan. We'll start with the absolute miracle of breathing itself. Then we'll see what happens when that process goes wrong. And finally, we'll get into the two main strategies science has come up with to manage asthma, the fast-acting rescuers and the long-term guardians. Okay, let's dive right in by looking at something we do thousands of times a day, usually without even giving it a second thought. I mean, just look at this. You can think of your entire respiratory system as this incredible, super efficient oxygen delivery network. Air comes in, travels down through all these tubes and branches, and ends up in the lungs. It's this amazing machinery that lets us pull in oxygen and trade it for carbon dioxide. And this whole shebang, it's called respiration. But it's really a two-part deal. You've got external respiration, which is the part we think about, the physical act of breathing in and out. But then there's internal respiration, and this is crucial. It's the process of getting that oxygen from your lungs to every single cell in your body. Okay, so that's how it's supposed to work. It's pretty seamless, right? But what happens when that whole system gets disrupted? Well, that's when we start talking about the mechanics of asthma. So what is asthma, really? It's defined as a chronic inflammatory disorder. And those two words are absolutely key here, chronic and inflammatory. It basically means the airways are in this constant state of high alert, something called hyperreactivity. They can totally overreact to all sorts of triggers, from pollen to something as simple as a blast of cold air. And wow, this image really brings it home. It shows you exactly what's happening inside during an attack. On one side, you see a normal, wide-open airway, but on the other, it's a triple whammy. First, the muscles around the airway clamp down tight. Second, the walls of the airway get all inflamed and swollen. And third, the body produces this thick mucus that just clogs everything up. And all that chaos happening on the inside, that's what causes those familiar and, frankly, pretty scary symptoms. That sudden shortness of breath, the tightness in your chest, that distinct wheezing sound, and a cough that just won't quit. It's the body's massive overreaction to a trigger. So the big question is, you see, treating asthma isn't just one thing. It's actually a really clever two-pronged strategy. You've got your rescuers, designed for immediate emergency relief right in the middle of an attack. And then you've got your guardians, who work in the background, playing the long game to prevent attacks from even starting. Let's start with those rescuers. Their official name is bronchodilators, and their whole purpose in life is immediate relief. They are the firefighters. Their only job is to tackle that muscle constriction and get the airways open fast. They don't deal with the inflammation or the mucus, just the immediate crisis. So how do they actually work? Well, the most common ones, known as beta-agonists, are pretty slick. They pull off this amazing little chain reaction. They're basically designed to mimic what adrenaline does to the lungs. They stimulate these specific receptors, which kicks off a chemical signal that basically yells at the squeezed muscles to just relax. And boom, the airway opens up and you can breathe again, often within just a few minutes. Of course, you need to get this medicine to the lungs, and fast, so it's typically delivered right to the source. The most common way is a metered dose inhaler, that quick puff of medicine. Or, in more serious cases, a nebulizer, which turns the medicine into a fine mist that you can breathe in over a few minutes. All right, so that's the rescue mission. But what about preventing the fire from starting in the first place? That's where our second strategy comes in. This is all about proactive defense, preventing the battle before it even begins. Now, this is super important to understand. Guardians are completely different from rescuers. You would never use a guardian in the middle of an asthma attack. It just wouldn't do anything. Instead, their job is to work quietly, behind the scenes, to tackle the root cause of the problem, that chronic inflammation and hyperreactivity. So who are these guardians? Well, the MVPs of the group are inhaled corticosteroids. These are really powerful anti-inflammatory drugs. Day in and day out, they reduce the swelling, calm the irritation, and cut down a mucus. Over time, this makes the airways way less likely to freak out when they encounter a trigger. And this is where the real molecular magic happens. Check this out. Corticosteroids are so smart because they get in there really early in the inflammatory process. They block this one key enzyme, By doing that, they stop the whole cascade of inflammatory chemicals from ever being produced. It's like cutting the power to the inflammation factory before it can even start production. But that's not the only way to play defense. There are other types of guardians, too. Take leukotriene antagonists. These guys work a little differently. Instead of stopping those inflammatory molecules from being made in the first place, they act like a bodyguard or a shield. They physically block the spots on the airway cells where those chemicals would normally latch on, so even if they're floating around, they can't cause any trouble. So, here's probably the most important takeaway of all. Effective asthma management isn't an either-or choice. It's not about rescuers or guardians. It's all about a smart, combined strategy using them together as a team. And this table, it just lays it all out perfectly. You've got your rescue inhaler, like a salbutamol, on standby for those just-in-case moments. And then you have your daily guardian, your controller med, something like an inhaled corticosteroid or a leukotriene antagonist, working 24/7 to keep the underlying inflammation in check. It's this partnership that truly empowers people to live full, active lives. Ultimately, when you think about it, this whole dual strategy is brilliant because it directly addresses the two main goals of treating asthma. You absolutely want to relieve those acute attacks when they happen, but you also want to reduce how often they happen in the first place. One gives you immediate freedom, the other gives you long-term stability. By targeting both sides of the problem, the muscle constriction and the inflammation, modern medicine gives us this incredibly powerful 1-2 punch for managing asthma. And as our understanding of this stuff gets deeper every single day, you just have to wonder, what's next? What could the next generation of rescuers and guardians possibly look like?